Introduce yourself and the discussion topic.
Hi, good afternoon. I'm Heath. I'm Dr. Udani. Today we're going to be talking about spinal anesthesia, and I want to give you an idea about what that's about.
Describe the indications for the procedure.
The indications for spinal anesthetic is that surgery can either be performed with general or regional anesthesia. We prefer to use a spinal anesthetic because it gives better pain control, and we can talk about that in just a second.
Describe the benefits of the procedure.
The benefits of a surgical anesthesia with spinal is that you can get better post-op pain control. You'll be able to get decreased blood loss during the surgery, and you can actually have less general anesthesia during the case.
Describe the procedure itself in clear, simple language.
So, Mrs. Tanaka, when we do the spinal procedure, there's a couple steps we're going to ask you to follow. First, you're going to have to sit up at the edge of the bed in the operating room and curve the back of your spine out for me. I will put some monitors on to make sure we're monitoring all your vital signs, and we might give you some medicine to help you feel a little relaxed. I will then clean your back to make it sterile, and then you're going to feel me give you a little bit of numbing medicine around the area in your lower back. Once we give you that medicine, we're going to start working a little more with the spinal needle, and you might feel some pressure in your back. If you're feeling any pain at that time, let me know. We'll give you some more numbing medicine, and we'll start again, okay? Once I give you the anesthetic medicine in your back, your legs are going to feel very warm, and they're going to start feeling numb, and then we'll lay you back flat on the bed and get started. Up until this point, do you have any questions for me about the procedure and how it's done?
May I have a back pain?
Well, I'm going to tell you about that right now, but there is an incidence of having some back pain around the area. It's more of a pain that'll go away just as if you were having any sort of needle in your body, so it should go away within a day or so, okay?
Describe the minor risks of the procedure.
This procedure is very safe. We do it all the time as anesthesiologists. The most common side effect is that you may develop a headache 1 to 2 days after the procedure. It's a special type of headache, and we're going to be monitoring you for that. If it occurs, we'll be able to take care of you, okay? You might develop a bruise or tenderness also along the back. I think that was your question. This is rare, but it might occur and it'll go away in a few days. Sometimes we can also, during the procedure, touch a nerve with our needle, and you might feel a sensation from that. It's a very transient feeling, and it'll go away after a while. This medicine that we put in the back might also cause your bladder to be a little tight. We might need to put in a catheter to help you drain your urine if we need to. And then you might also develop some itching from the medicines that we put in the spinal anesthetic. But those are some of the common but less intense side effects, okay?
Describe the risks of serious complications. Emphasize that these are rare.
There are some serious complications with this procedure. Sometimes there can be some bleeding around your spinal cord due to this procedure, in which case you might feel your legs going numb and certain things happening that are foreign to you after surgery's over, and we're going to be monitoring you for that, and we'll take care of it if it happens. Again, I want to emphasize it's very, very rare. Again, anytime there's a needle that's inserted in your back, there's a chance that there might be an infection. Again, very, very rare, but we'll keep a close eye on you to make sure it doesn't happen. Okay?
Describe alternatives to the procedure.
There are alternatives to this procedure, and the decision to proceed with this procedure is yours. One of the alternatives is we can do what's called an epidural anesthetic, or we can do a general anesthetic. And both of those have their own risks and benefits, and if that's what you would like to do, we can talk about that in a little bit. have any questions at this point about the risks of this procedure?
Yeah, I'd like to know if during the surgery I will feel my legs or I will feel anything during the surgery.
Yeah, with this procedure, the spinal anesthetic, our goal is to give you very good pain control at the point of surgery below the point of our spinal. So you shouldn't feel any aspect of the surgery at all. Okay.
Teach back. Ask the patient to repeat key items in the discussion.
Could you tell me what you understood from our conversation and teach back the methods of what we're going to be doing in the operating room?
So, you told me the procedure is easy. I will sit up, you clean my back, put a little needle, and you put medication, and that's it.
Okay. And we talked a little bit about the risks. And are you comfortable knowing the risks of the headache and the back pain that question you raised? Are you okay with that?
I'm okay because you told me it's rare.
Good. Excellent. So this is perfect. I'll take this as an agreement that you would like to proceed with the spinal anesthesia. Is that correct?
Yeah.
Great. What we'll go from here is I'm going to go set up the room in the operating room, and we'll see when we're ready to go, but it should be another 15 or 20 minutes, okay?
Okay.
It was a pleasure meeting you, and I
See
look
you.
forward to taking care of you.
Okay.